Hi, Dr. Donita here. Super excited that you're back on another episode. Today we have Finn, who's gonna get neutered, and we also have Odin here in downtown Orlando, who's going to get his annual wellness visit. So come along on the journey with us today, see some new sights. Today we have Finn. He is getting neutered. He is an 8-month-old golden retriever. He's not your typical golden retriever. He's a little bit on the more nervous side, which is typical for us because I see a lot of nervous pets, dogs and cats, because I'm fear-free certified and we're mobile. So since we have this type of environment for them, it's a better place for really nervous pets. So he's a little bit more on the nervous side, but we're excited to help him, get him neutered. We just finished collecting some blood on Finn. He was super scared, so we had to cut away for a second because he started flailing and freaking out, just because this is his first time experiencing getting his blood drawn, so he was really nervous about that. And on top of him being a really nervous dog, it was really hard for him. We did get some blood for his blood work, so Ayana's working on that right now, so she's gonna go ahead and check his liver kidney value so we can make sure he's good to go before we do his surgery. So we went ahead and sedated Finn because he was not still enough to get the catheter in. So we went ahead and gave him a little bit of sedation so we can get it done. He's still there, but we still have to give him propofol to induce him because we need the muscles in the back of his throat to be relaxed enough for us to get the tube in. So we're giving him a little bit of propofol first. A fighter. So we're trying to wait until he doesn't have any jaw tone, but as we can see, there's still jaw tone. He said, fight to the finish. A lot of times when they're anxious and nervous, it does take more medication to give them to get them relaxed enough when they're already anxious. So we're gonna give them a little bit more. So now we're gonna turn on the oxygen and we're gonna turn on the gas. So this is the gas anesthesia. We just turn that on 3 and 3 to get him fully sleepy. We lubricate the eyes because they're not able to blink while they're under anesthesia. So we always lubricate the eyes really good. I do a pre-scrotal incision, so scrotum, you're gonna see that once I get the hair gone. So some places, more or less shelters, will do scrotal incisions, which is on the testicle, but just for safety and better and cleaner, pre-scrotal is a little bit better. Other myth buster that I hear a lot, people think that when you neuter too early, it stunts their growth. That is false, because I neutered a 9-month-old Rottweiler a couple months ago, and he grew another 25 pounds months later. So a neuter is not gonna stunt their growth. Now we're going to sterilely clean the surgical area now that all the hair is gone. So we always start with scrub first, start in the center and work our way outward. So once you work your way out, that is now considered dirty, and then you throw it away. Now that it's clean, you have this imaginary force field, is what I call it, where anything around here is now your surgical area. People always ask me, how do you get surgery done in such a smaller vehicle versus a surgical suite? Your surgery technique and your antiseptic procedures determine your success rate. It doesn't matter the size of the vehicle or the size of your surgical area. It determines on the surgeon and how well you know how to prep and keep your area clean and maintained. And that was from a boarded surgeon who gave me that advice and said, doesn't matter. All right, we are all done. This is our beautiful surgical incision, all nice and closed, just a little inflamed, but he did great for his procedure. Just that spice right there. So, and then we're gonna give him an anti-inflammatory injection under the skin, so he doesn't have any discomfort and pain when he's waking up. Sometimes they wake up fast, sometimes they wake up slow. He was a more nervous guy, so who knows which version we're gonna get. We will find out shortly. He's gonna go from I'm asleep to now I'm not asleep. Wait. Oh, wait. We are all done with Finn's neuter. He did great. He definitely wasn't the perfect patient, but we loved him dearly. He was just a really nervous guy, but we were able to get the procedure done, and mom and dad are happy, so we gave them the instructions and everything to look out for him. So he'll be back to normal within 10 days, ready to run around and play. So we'll see you at the next one. It's also used for separation anxiety. So I don't know if he has separation anxiety, but separation anxiety is usually if they're destroying stuff in the house and that kind of stuff. It's usually separation anxiety. Yeah, but if he's not doing that, that's why I'm saying the trazodone is plus or minus. If he needs something for actual anxiety, then there's, fluoxetine. We can always talk about that, but it doesn't sound like he's quite in the need for Prozac. I don't think we're there yet. He's a smaller dog, but this is a really high active dog. They're in the category with like border collies, and they're used to having a job. This is technically a working dog. He's a small dog, but this dog was bred to chase after vermin and critters. This breed has a job. We are all done today with our appointments. First was Finn. He got his neuter today. Super cute boy. He was a golden retriever. And then we ended with Odin, which was his annual wellness visit, the cutest little corgi. He definitely had more conversation because he has been dealing with some behavioral challenges with mom. So we talked about it. We collaborated about next steps for him so that he could get the right people. Good thing is we have lots of connections around Orlando where we can get him connected with the right pet professional to help him out. So we're excited to see how he does in the future. All right, thanks for watching. If you enjoyed this video, definitely leave a comment. Let us know if you want to see more like this. And if you have not already, subscribe to our channel, hit the notification so you can be tuned in for the next video. We hope to see you soon.